Hey class, this is Melissa Turvey-Seabury, again, your professor. So now we're going to go over week 4, and we're going to be looking and focusing on theories for crisis and trauma counseling. You don't have to have all the answers, just the courage to stay present in the storm. We've spent the first half of this course deepening our understanding of trauma and crisis. And now we're going to explore how these experiences profoundly affect the brain, body, and relational systems. Now we shift our focus to how we respond as counselors. Our essential task is to bridge theory with practice to moving from knowing about trauma to knowing how to sit with it compassionately. For this week, we will identify key theoretical frameworks and examine frameworks that guide crisis and trauma counseling practice. We're going to distinguish crisis intervention from trauma counseling and assessment and treatment, and analyze how ethical, cultural, and personal values shape counseling practice. Crisis counseling is short-term, immediate, and stabilizing. It focuses on safety and orientation by providing techniques that help clients gain some sense of control. Trauma counseling is long-term, integrative, and transformative. It helps to make meaning out of the client's experience and assist with the client developing emotional regulation. So in these chapters, or these 2 chapters, you're going to really cover different theoretical frameworks, but we know that there's other ones that are out there. We have trauma-focused CBT and polyvagal theory. This book talks about expressive and creative approaches, but we don't want to forget EMDR, brain spotting, accelerated resolution therapy, and prolonged exposure. And this week, we'll talk about all of those. Duffy and Haberstraw emphasize a crucial truth. While evidence-based protocols and structured manuals provide essential scaffolding, the heart of trauma counseling lies in shared creativity between the counselor and client. This creativity invites flexibility, safety, and empowerment into the therapeutic relationship. So when we integrate art, storytelling, breathwork, rhythm, or movement into sessions, we're offering clients new pathways to express what has been unspeakable. Ethical and cultural responsiveness means that theory must always be filtered through ethics, culture, and personal values. An intervention that proves effective in one cultural context may feel intrusive or disrespectful or unsafe in another. So cultural humility is really important this week, and it requires us to remain students of our clients' lived experiences. So some examples, questions for trauma-informed practice include, does this approach honor the client's worldview and cultural identity? Am I acting from humility rather than assumption? How do my own emotional boundaries influence my presence? Something that is just as important and part of a counselor's responsibility is to stay present without becoming overwhelmed. Trauma-informed care demands awareness of our own capacity and limitations. Ethical responsiveness means pairing clinical techniques with genuine attunement and ongoing self-reflection at every stage of treatment. So the theories that we study this week aren't meant to be simply memorized. They're designed to guide your clinical intuition and therapeutic creativity. Your goal is to become fluent enough in these theoretical approaches to tailor them ethically, collaboratively, and responsively to the unique client that's sitting across from you. As you engage with this week's readings and assignments, carry this truth with you. Effective trauma counseling doesn't require having every answer or mastering every technique perfectly. For this assignment, you're going to have a few options. Each option requires you to engage critically with the course material and reflect on your emerging counselor identity. Option 1 is a case conceptualization. This will give you an opportunity to explore how you would apply one or more theoretical frameworks from the reading. Some guiding questions are: how do different theoretical lenses illuminate various aspects of crisis and trauma? Option 2 is a creative project. Visually or audibly explain key concepts from this week's readings. A guiding question is: how can creative expression effectively communicate complex theoretical concepts and practical applications in crisis and trauma counseling? And lastly, option 3 is a reflective essay where you will write a 2 to 3 page personal reflection discussing the following points. Which theoretical approaches for crisis and trauma counseling resonate most with your emerging counselor identity, and why? A guiding question could be: how does theoretical understanding intertwine with your personal identity and cultural lens to shape your approach as a crisis and trauma counselor? I look forward to seeing your creativity this week and the freedom for you to choose what best fits for you and how you can describe what you're learning regarding theory and crisis and trauma counseling.